Bonjour tout le monde. Je vous bienvenue au séminaire de midi de SIX. Nous avons une présentation cet après-midi de Martin Renaud, qui est le... I should switch to English because we're doing a presentation in English today. Welcome to the séminaire de midi for SIX. We have a presentation today from Martin Renaud, who is Chief of the Income and Housing Statistics section in the Social Statistics Methods Division at Statistics Canada. And his presentation is on the use of crowdsourcing at Statistics Canada during the COVID-19 pandemic. And just before we get started, I'd like to also let you know that this webinar is being registered. So if you have friends, colleagues who have not had a chance to join us today, they can catch up and see it later. And there will be a period of questions at the end of the presentation. The presentation's about 35 minutes, and then we will take questions. We'll ask you to put your hand up, and then we will open your mic and allow people to take questions for about 15 minutes. So that's, I think we can start now. I hand the parole over to you, Martin Renaud. Welcome.
Okay, thank you very much, Lisa. Thank you for inviting me. Happy to be here. Let me just go ahead and I will share my screen. And I will start the presentation. And it should be a go. So Lisa, thumbs up. You see the presentation fine on your side? Good. Okay, perfect. Thank you so much. All right, so welcome everyone. I will talk to you today about the use of crowdsourcing at StatsCan in the context of the COVID-19 pandemic. So this presentation is exactly the same one as I did in early February, but this one was in French. This one's in English. So what are we going to talk about today? Presentation plan. First thing, I'm going to give a bit of background as to how did we come around to use crowdsourcing, and I will explain what was our role in methodology in this new venture, new project. And then I will briefly talk about some methodological considerations that should be considered when we want to use crowdsourcing, and briefly touch up on some of the research projects that some colleagues of mine have done in StatCan. And from this point on, moving forward, what are we going to do with crowdsourcing? So first things first, a little bit of background. Crowdsourcing is a word that can take on many different meanings. In the current context in StatsCan, we use the word crowdsourcing to refer to a non-probabilistic method of collecting data where we invite all members of a certain target population to participate on a voluntary basis in some kind of data collection exercise, and this is on a particular topic of interest. So crowdsourcing first started in StatCan before the pandemic. We had our first crowdsourcing experiment with a building register in the Ottawa-Gatineau area, where people were asked to update any kind of information that they know about buildings in their neighborhood or in their city. And we collected that information for a couple of months. And we did have some people who contributed a whole lot, others just on a 1 or 2 time basis. But bottom line is it was a success because we collected a lot of information about the footprint of our buildings in the National Capital Region. And then the second venture in crowdsourcing was when we decided to use, or actually we decided to use crowdsourcing to collect data information on cannabis. If you remember, cannabis was legalized in October 2018, and the federal government wanted to know, do we have statistics that we could use to measure the impact of the legalization of cannabis? And we didn't have anything. Here, in this case, the issue was collecting data on something that was still illegal at the time might be a challenge. So we opened up an anonymous crowdsourcing portal on our website where people could go and say how much cannabis they bought, which region they bought it, and how much they paid. So we were able to produce statistics before and after the law came into effect. Of course, the statistics we've collected before. It was not done as part of a regular probabilistic survey, but it still had some use, and there was some processing done to exclude outliers, things like that. But that was the second venture into cannabis. And because that was a success, we decided to use it again a third time, this time to assess the market basket components. Market basket measure is now officially in Canada the measure that is used to determine people who live in poverty. And the market basket measure is essentially a basket of goods and services that households need. And if a certain portion of the household income, or if more than a certain portion of the household income is needed to pay for those goods, then you are considered to be under the poverty line. So essentially this time, crowdsourcing, we just again open another anonymous portal where we ask people what their postal code was or region. I forget exactly what it was, because market basket measure, it varies depending if you live in rural PEI or downtown Toronto. The same basket of goods will be much more expensive in Toronto, for example. So based on the postal code, it would fetch some data in a database and then say, okay, well, based on the postal code you gave us, in your area, house insurance, a payment of house insurance of $2,000 a year. Does that make sense? Is that too low? Is that too high? Or is it just about right? And we went through all the different components of the market basket measure like that. And this data was used in reassessing the content of the market basket. So these were the 3 times we used crowdsourcing. And because of those 3 experiments, we decided, you know what, maybe it would be a good idea if we start writing some kind of document where we summarize methodological considerations when we do crowdsourcing. Because of course, like I said, in cannabis, for example, some people could come in with data that just does not make sense. So we've got a lot outliers. How do we treat that? How long do we stay open? How long do we leave the portal open? What kind of processing can we do, so on and so forth. So we started writing this document on crowdsourcing, and then boom, all of a sudden, it's March 2020, COVID-19 has been declared a pandemic, and the federal government realized that we don't have any data on COVID. There's a big data gap, and we need data, and we need it now. It's very urgent. So what can we do? How can we set up something very quickly to get some data? And the crowdsourcing issue or a venue alternative was considered. And the time, if you remember, pretty much the whole country was shut down. Citizens were really engaged. So we thought, you know what, conditions are favorable, so let's use this. It's still some kind of experimental mode, but we did get some previous experience. So we did get the go ahead, and I think it was pandemic was on March 11, if I recall, and then we all stayed home on March 16th. And I think on March 24th or something like that, we got the go ahead to use crowdsourcing to collect data on COVID-19 and the impact it has on the Canadian population. And from that, the impact of COVID-19 project was created, and April 3rd or something like that, we were on the field. So in less than 2 weeks from the go ahead, because we already had some tools we could recycle, we were able to quickly turn around, prepare questionnaires, load that in our portal, and do a quick blitz publicity campaign. And we would ask people to come and share data with us. So so these are the crowdsourcing projects that we have done that are related to COVID since the beginning of the pandemic, and we've got 9 of them. The first one was just very general, and this one ran from April 3rd to April 24th. And as you can see in the little graph on the right, we got close to 250,000 participants. We were kind of flying blind a little bit. We didn't really know what to expect, how many people are going to participate. Our goal was to have about 1,000 a day, and we thought we would keep the portal open for about 2 weeks. So we thought, you know what, around 15,000, we'd be happy with that. We opened up the portal on, I think, a Friday, or late Thursday evening, early Friday morning. And by the time we had the first look at our data file the next Monday, we had about 130,000 participants already over the first weekend. So it was like way beyond expectations. But it did help that this first crowdsourcing initiative was picked up by CTV and other news, but CTV had something on their website and they talked about it on the news. So lots of people, I guess, heard about that, and they went to our website and completed a questionnaire. So it was such a success that we decided to extend the collection for an extra week. And that's why we ended up with close to 250,000 participants. And at the same time as well, if you remember, at the beginning of the pandemic, schools were closed, and especially post-secondary students, they had lots of concerns. Will I graduate? Will I get my diploma? I had a job lined up. What if I don't get my diploma? Do I still get my job? So there were lots of questions concerning post-secondary students. So this was the second one to take to the field. This one was not the entire Canadian population, but just post-secondary students. And this one, we got a bit over 100,000 participants, which was quite impressive given the fact that we have about 1.2, 1.3 million post-secondary students in the country. So it was close to a 10% participation rate. And then the topics, they kept coming one after the other without much break. Between late April and the end of August, we ran crowdsources on mental health, perceptions of safety, trust in others, parenting during the pandemic, living with long-term conditions and disabilities, and experiences of discrimination. Then we had a little break from the end of August to the end of November, and then there was another one. This one was targeting the healthcare workers, and they wanted to see what the impact of COVID-19 was on this population. So these are the ones we've run so far. I'll tell you a bit more of the background. In the first crowdsource, and one thing I should mention is that crowdsource is meant to be quick. So we want to be in and out. We don't want participants to take a half an hour to answer our questionnaires. We had a maximum of 12 questions or so. We extended it to about 15, but we thought, you know what, it should not take more than 5 minutes, 10 minutes maximum for the respondent, the participant, to provide their data. So first pass at it, we ended up with like 9 socio-demographic questions, which we said it's too much. We just cannot ask 1 or 2 other questions. So we toned it down a little bit. We ended up having about 5 socio-demographic questions, 7, I believe, questions more in line with COVID and the impact. And then at the end, we asked people if they would be willing to share their email address with us or a telephone number at which they could be reached. And we were quite surprised to see, surprised and quite pleasantly surprised to see that a little bit more than half, about 130,000 people shared an email address with us. So we were explaining to them that we could use that to contact them in case we run other crowdsources. But as you've seen, we've ran 8 other ones. So starting with the second crowdsource, the one on mental health, we made use of those email addresses because the second one, novelty wears off, and it wore off fairly quickly. We didn't get the 130,000 participants the first weekend. I think if you, we'd have to go back to the slide, but we had about 49,000, close to 50,000 participants in that one. But there's a caveat there. We used those emails that we got from the first crowdsource, where we contacted some people, not everybody who provided us with an email, but I think about half of them were contacted, where we told them, thank you very much for participating in the first crowdsource. Your data is very valuable. If you click here, you can see what the results are. And in case you are interested, there is another one going now. It's on mental health. And if you want to participate in that one, please click here. So it did boost our participation. And every crowdsource thereafter, we collected email addresses and phone numbers from participants. Of course, some of them were repeat customers. They would provide us the same email address every time. We would see that. But everybody who was new, who had not participated in the crowdsource before, had the opportunity to give us their email addresses. And the next crowdsource, we would always use email addresses that we've collected to get back to people, say thank you for sharing your data, and there's another one ongoing. So it was a way to stimulate participation for us. Of course, we would manage that to make sure we did not send an email to someone 2 crowdsources in a row, and we want to minimize the burden. And like I said, some of those crowdsources we ran, the post-secondary one or the one on parenting, for example, they were targeted to a specific population. So we did not make use of the email addresses because we did not know sending an email to that particular address. Are these people parents? Do they have children in their household? We didn't know. So in that case, we just did not use the email addresses. So that's a bit about the background. What's our role here in methodology? Well, like I said, crowdsourcing is a non-probabilistic way of collecting data. And what we have seen is that even though we got 250,000 people who participated in the first one, it's still less than 1% of the Canadian population. And that means there's a lot of bias. So our efforts and methodology were geared towards four different things. One, we wanted to find ways to mitigate this bias. And then can we ensure the data quality and the rigor of the data that we've collected? How can we validate the results? And we pitched in, we helped in guiding the interpretation and the analysis, because this is something that's not quite in line with what we do on our regular surveys. So a little bit more about these things. Mitigating bias. This table that you see to the right is an example of a daily collection monitoring table that we would produce. Cells in red indicate that we are behind what we would expect in terms of number of units participating in that particular cell. A cell in green means that we have achieved a target, or we have exceeded the target of what we would have expected. And those in blue, it's in between. It's on the way. So it's not so bad, but it's getting there. And again, this is very arbitrary, and we don't have to look at all the numbers, but we would look at this table and say, okay, cells in red. In this case, for example, you can see young males. The first age group was, I believe, 15 to 24 years old. Well, it's all red. So it means that we haven't collected as much cases of young males as we would have expected. So our communication strategy made efforts to particularly target young males. So we have young people who were not participating a whole lot. We saw in the first crowdsource that about 3/4 of our participants were women, and every crowdsource thereafter, it was the same thing. And even after a day or two of collection, we could see that split, about 3 women for 1 man participating, except the one on parenting, where it was even worse, because usually it's the mother who takes care of children in the household, or more about their health and these kind of things in their schooling. In that one, we had about 90% of the participants who ended up being women. Teens and seniors did not participate a whole lot. And we had some provinces who were always participating more than others. Ontario, Nova Scotia were provinces where we did see lots of participants, more than what we would have expected. Quebec, not so much. So anyhow, so that's one way we tried to mitigate some of the bias, by looking at what kind of data have we collected so far. At the end of collection, we said, okay, well, we know we don't have enough young people, or we don't have enough men in our sample. What can we do to correct for that? We implemented what we call a benchmarking strategy. For those of you who are familiar with different steps in a survey, it's essentially a post-stratification, where we calibrated to known control totals. In this case, we have our demography division produces control totals of how many people we have in Canada by province, by gender, and by age groups. So we use those totals, and we just calibrated our sample to that. So if we have, for example, in Ontario, if we know we have 100,000 men between 65 and 74, well, okay, we will make sure we ended up with 50 in our sample. Well, we will multiply each of these units by a factor that will make it so that once we add them up, we get back to the 100,000. So in this case, we'd give everybody a weight of 2,000. We didn't call that a weight, and we didn't call that post-stratification, because it's all in a non-probabilistic context, and we wanted to make the distinction between our regular surveys and the crowdsourcing. And I'll get back to that a little bit later. And of course, when we did not have enough units, perhaps having an age group between 25 and 34 in PI, if we only had 1 unit, well, maybe we did not want to make that unit representative of everybody in PI in that age group. Well, we would collapse some categories. So maybe we had to make age groups larger, from 25 to 49, for example, or something like that. So this is one way. I'll quickly go through the next couple of slides because this is just to give you an idea what kind of control totals we use for each of those collections we've done. So for the general POP, for mental health, perceptions of safety and trust in others, we've used our February 2020 demographic projections of number of people by province, section, age groups. The post-secondary students, we had counts of how many students were enrolled in the post-secondary program, but only until 2017 or 18, I forget. So we just did a little projection. We looked at what was the tendency through the years, and we projected a number of enrolled students on March 1st, because that's the reference date that was given in the crowdsource. Again, we did that for different groups. It was number of students enrolled by sex, by province of study, and by level of study. For the parenting during a pandemic, we have some data at StatsCan where we have a count of number of families. Again, this one was from a previous year, so we just projected those counts into 2020, and we used number of families where there was at least one children 0 to 5 years old, or 0 to 14, 6 to 14, or they had children in both age groups, so the 0 to 14. And then living with long-term conditions and disabilities, we simply use the 2016 census counts of people living with a long-term condition or a disability, again, by province, sex, and age group. We did not adjust those numbers because from one census to another, these numbers are very stable. So we decided just to go with the numbers we had. Yes, they're a bit out of date, but not enough to make a significant difference. Experiences of discrimination. This one was ran later in the summer. So we did the same thing as the first couple of crowdsources, but we just replaced the February demographic projections with June demographic projections, and we added another dimension. It was the visible minority status, because we had started collecting it. I think started on the third crowdsource, if I believe. And the healthcare workers one that we ran in the fall. In November, December, we used the number of healthcare workers by province and type of job as our control totals. So this is what we've done. That was one part that we've done to mitigate the bias as much as we could. Ensuring rigor and data quality. Well, we've done some basic verifications. We would ask people for their postal code. Well, we made sure we got a valid postal code. So if someone would type in HOH, OHO, well, I don't think anyone lives in the North Pole. So we did some detection on invalid postal codes like that, and we just discarded those data. We did a little bit of outlier detection. For example, in the parenting one, we would ask how many children in your household between less than 1 year old, 0, 1, 2, or 3 plus, I believe. And then 1 or 2 years old, 3 and 4, 5 and 6, so on and so forth. So if someone would always say 3 plus, I doubt that we have some households with 15 kids under 6 years old or something like that. So we discarded some of those outlier detection, but it was just an odd case here and there. Out of scope records as well. This is something I should have mentioned before. Crowdsources, we're targeting people age 15 years and older. So if someone would give us their age as less than 15 years old, we would consider them out of scope and we would just remove them from the file. And then we verified we did some basic checks to see, do we have any collection issues? For example, do we have participants that answer more than once? When you are selected to participate in a survey, a probabilistic survey, you might get a phone call from an interviewer or get a letter in the mail, or census is coming in the spring. You will get a letter in the mail, and there will be a website where you can access your questionnaire, enter your unique access code, fill in your data, and then once you're done, you just say submit. That's it. You cannot go back. You cannot repeat the process. You cannot send in a second questionnaire. In crowdsource, there's no such limitation. So people could participate more than once, and we've seen it happen. And why I say we've seen it, we didn't have much to identify those people, but we had the email address, we had the phone number, we had some of the social demographic questions, so gender, age, we had the postal code. So we would see people within the same crowdsource participate more than once. More so in the first one, where people at the beginning of the pandemic, many people were scared of losing their job, or were in a situation where there was a lot of uncertainty with regards to many different things in their lives. but the collection was open for 3 weeks. So some people who might have been in a position where their job was not secure in the first week, then all of a sudden they learn in week 2 that, yes, you're going to get to keep your job. Well, they came back and they submitted another questionnaire with updated data. So we've seen that happen, but we haven't seen anything that caused an issue or that would be an issue which we would be concerned about so far. We validated the results. So again, this is a non-probabilistic collection, so we have no control on who comes to the application, who provides data. So we said, what kind of other reliable source can we use to compare our results to make sure they are lining up? And around the same time as we launched the crowdsource, maybe 2 weeks before, we had another project that was launched, this one called the Canadian Perspective Survey Series. This one was a typical probabilistic survey on a much smaller sample size. About 7,000 people were contacted. And for the first crowdsource, if you remember, we didn't have much time to get set up. So we recycled a lot of content of the Canadian Perspective Survey Series in our first crowdsource questionnaire. So we had a good basis for comparison. And we compared our results to theirs, and we had a much larger sample size. Yes, we did have some bias, more women, not enough younger or older people, but overall, at the Canada level, we were still lining up fairly well. So this was a way for us to validate. For example, at one point, we introduced a gender diverse option, so people couldn't answer more than men or women. They would have the option to provide us with a more detailed answer about their gender. And we compared these results to what we had seen in our census test results. And this time we were really completely different. We had about 20 times more people reporting a gender diverse answer than what we've seen in the census, especially in the discrimination crowdsource that we ran. So for us, it was a way to say, okay, well, yes, if we see differences, can we explain them? And if we are in line, doesn't guarantee we're in line everywhere, but if some of the results are in line with some other sources, then at least we're doing an okay job so far. We also compared our raw results with the benchmark results. So those results after the benchmarking factor that I explained a few slides earlier, to see how much difference there was between the two. And usually I would say, rule of thumb, we were within about 10% from one another, sometimes as close as 1%. Okay, I said I would come back to this letter. Here we are. We pitched in to help guide interpretation and analysis, because again, and this is the thing we always have to remember, crowdsourcing is a non-probabilistic way of collecting data. So we are not in the traditional probabilistic survey context. In the survey context, we always talk about respondents. In this case, we did not want to talk about respondents, so we decided to use the term participants. And in French, it's much more in line, because crowdsourcing in French translates to approche participative. So we felt that using respondents, and again, using survey or estimates or weighting, could give someone using the data a false sense of reassurance or confidence that, yes, data is very statistically and methodologically sound, which in this case, many of the different steps that we have in surveys were out of our control. So we replaced respondents with participants. We replaced survey with, we call that a data collection initiative. We did not talk about estimates. We talked about results. We did not talk about weighting. We talk about benchmarking. So they are, say, the little cousin in the non-probabilistic context. These are the little cousins of the different terms that we use usually for surveys. We also made a point to present to the users in our articles and in our documentation the fact that there is no data quality measure coming with that data. We don't have the traditional CVs. We don't have confidence intervals. We don't have margin of errors. Again, because this is a non-probabilistic data collection, there is no known probability of selection. So there's no known probability of selection. The only thing we would do is do the benchmarking, where we would calibrate. But in the absence of that probability of selection, we just could not produce any of those usual data quality measures that people have come used to. And we always put a warning, a sentence or two, like the one you see here in the blue box. Unlike other surveys conducted by Statistics Canada, crowdsourcing data are not collected under probability sampling design. As a result, the findings reflect only the responses of those who completed a questionnaire and thus cannot be generalized to the entire Canadian population. One thing as well that we mentioned, we said we should not produce totals. Crowdsourced data is not geared towards that. We should only produce proportions because, again, we felt we are not in a position to say in Quebec, I don't know, 1.2 million men have lost their job. Or I'm just making something up, but crowdsourcing cannot go that far. We can say 52% of the reporting men in that age group feared losing their job. And again, we made sure that all the text was geared towards the fact that only representative of these people. So we would never say something like 22% of the Canadian population, no, 22% of the participants. So these are little things, but we need to be really picky in these kind of situations because, again, we don't want to give a false sense of security and quality and the rigor that is not necessarily there with the crowdsourcing approach. Okay, methodological considerations. So I mentioned earlier that we had written a document on methodological considerations about the use of crowdsourcing as a way to collect data. So this document, what is it exactly? Well, it just explains briefly what is crowdsourcing, what's its purpose, and goes into some considerations. Again, inferential limitations that we cannot necessarily generalize. And I'll talk in the next couple of slides about two things that we give a bit more information in that document. It's how do we prepare for crowdsource when we want to collect data that way, and what should be considered, or what should the point that should be considered when we release data that we can produce from collected crowdsourced data. So preparing for the crowdsourcing data collection, there are a series of different steps, very similar to what we find in a regular survey. We've got in StatsCan since fall of 2019, about a year and a half, we've implemented what we call the principles of necessity and proportionality. So we need to demonstrate those principles. It's a series of steps and questions that we need to go through. Can we get the data somewhere else, or is it appropriate that we collect that data, and so on and so forth? What kind of efforts do we put into that? But this is a step that we now have to go through for all our surveys, and same thing for crowdsource. Again, if we want to run a crowdsource, we need higher management approval. The questionnaire that we use when we run a regular survey, we have in StatsCan what we call the Questionnaire Design Resource Center, and this unit has to be consulted every time we prepare a questionnaire for a survey. Well, same thing in the crowdsourcing context, you need to consult those experts to make sure that the questionnaire meets the strict quality guidelines that they have. And then, just like a survey is a collaboration between many different areas, same thing with crowdsourcing. So there should be consultation with people from subject matter who can drive the content, methodology, who can reduce bias, ensure rigor, data collection experts. It's really important that we get people from collection involved because they are the ones designing the app, and they are the ones taking care of all the transmission and collection issues. And then communications expert as well, because crowdsourcing, a big part of the success of crowdsourcing to bring people in was how effective was our communication strategy. And as I mentioned before, when we would see people in a particular group that we would not have enough participants based on what we would expect, well, we would turn to those communication experts who also have contacts outside the agency, and we would try to target those people in those areas. If you remember the little table I showed, those cells that were in red. Preparing for crowdsourcing data, we have to develop the crowdsourcing tool. Of course, we had some previous experience. In our case, it happened fairly quickly. Data verification rules, how do we prevent any outliers? Do we have any quality indicators that can summarize the verifications that we've done? And how can we assess comparability? These are all things that should be considered when you prepare for crowdsourcing. One thing that I feel we are still vulnerable is some safety measures. I talked briefly earlier that we try to compare or try to find out if we did have people participate more than once. Yes, we did, but it would be nice to perhaps collect IP addresses. Again, this is something, it opens another Pandora box. Can we do that? Is this something that is ethical to do? Do we have the right to collect IP addresses? that's something else. But if we could collect IP addresses, it would be a way for us to assess, oh, this IP address participated 500 times. Maybe something is fishy here. We have to find a way, in my opinion, to prevent against some bot answers. Right now, I mean, there's nothing preventing someone from writing a little program and then just submitting 10,000 questionnaires on one data collection initiative that we have. So it would just screw up the whole data. And these were identified as priorities by our advisory committee on statistical methods. So we are working on that for now, but we are still not there yet to the level I think would be safe for us. Outlier detection, confidentiality measures, even though it's anonymous, perhaps the combination of certain answers to certain questions could make it so that we could identify someone. And because this data is collected under the Stats Act, we need to protect confidentiality of all participants' data. And then what should we do when we prepare to release results from crowdsourcing? You remember the little text, the little couple of sentences in the blue box? We should always incorporate some kind of statement like that to inform users of data limitations, and maybe not necessarily limited to that, but give people information on who was invited to participate, the fact that it was done on a voluntary basis, when did collection happen, how many questionnaires, valid questionnaires did we get? Like I said, start, end of data collection, give some information about the processing we've done. How did we correct for outliers? How did we, or which data were excluded and why? Again, the disclaimer about the absence of the sampling design, provide information about the benchmarking process that we've implemented, if there was one, give a warning about the bias, the interpretability, that you cannot generalize, and if any quality indicators were produced, they should be mentioned. So of course, maybe not all these points are valid or applied to or applicable to a particular crowdsourcing data collection, but they should at least be considered. So we are currently in the process of developing a directive. I think the word directive here is not quite right. It's more a guideline on crowdsourcing at StatsCan. It's in the last stages of approval. This guideline talks about the legal context, provides some definitions, talk about the objective of crowdsourcing and what are the expected results, and lists the responsibilities of every party involved. So we've got many, many guidelines in the federal government. We've got many in StatsCan, but we didn't have one on crowdsourcing. So based on what we've learned, we've prepared this guideline, which should be available in the next couple of weeks. And now, before we conclude, just a quick word on some of the research project. So why was research needed? If you remember, like I said, the first crowdsourcing cycle, there was an urgent need for data. So we did not have time to implement any fancy methods. So that's why we just went to, okay, let's correct for bias by doing some calibration on age, sex, and province. That's pretty much all we could do with the time we had to reduce for bias. But there are other methods that could be used, more fancy methods, more sophisticated methods. So some colleagues of mine undertook research projects with crowdsourcing data and using other auxiliary variables from admin data, from other reliable surveys, for example, the labor force survey. And they went on to develop 4 different research projects on how could we combine or how could we integrate data. So essentially combining the crowdsourcing data with data that is collected from another probabilistic survey. So I'll just briefly go through the different projects. The first objective was, can we reduce the bias of the crowdsourcing estimates? You remember I said there's less than 1% of people who participated, so there's huge bias. Can we correct using a non-biased source like a probability survey? So 2 methods were investigated, the propensity score weighting, where some auxiliary variables we noticed, like for example education, were very effective at reducing bias. And the thing is, even though education is still useful, there is still some bias, because if you remember, I said crowdsourcing, the content of the questionnaire was quite limited. So we cannot collect 20 questions and 15 social demographic questions to go along with that. So it would be nice to have marital status, because perhaps single people might have a different response pattern or participation pattern from married people. But we didn't have that. And there are the job type. There might be many other variables that could be use to explain the bias, but we just cannot collect them all. So even though some variables like education were effective at reducing bias, there's still some bias in the data, and we know that. We used another method called sample matching, and we found out that this method was reducing bias, but it was not quite as effective as the propensity score weighting method. The other projects that we've undertaken was, okay, well, probability surveys don't have the same sample size, large sample size in a short period of time. I mean, even those crowdsourcers that we ran for 2 weeks, where we ended up with 50,000 participants, that's a lot. So can we use that volume of data to the benefit of the surveys? Can we use that to produce small area estimation, for example, where the goal would be to reduce the variance of the probability survey estimates? And for example, small area estimation was a method that could be used, and we've seen some substantial precision gains. But the thing is, those gains are noted for some variables, but not all characteristics of interest. So for some of the characteristics we collect, yes, we can have a precision gain, but for others, not so much. And it is especially true for those smaller proportions that are near zero, or the larger ones that are close to one. Dual frame weighting was another method that we use, but what we've seen so far is that the variance reduction is quite small. We would expect a larger reduction in variance if we could get a larger participation rate in the crowdsourced context. So that's all I will say about research. And now moving forward, so from this point on, what do we do? Well, again, this is something that's really important. More and more people want to use crowdsource. They want to use crowdsource as a tool to collect data, but we have to be very careful. We have to really analyze the situation before we jump into crowdsources. We blindly jump into crowdsourcing, because crowdsourcing can do some things, but there are lots of things that it just cannot do. So if people going into a data collection using crowdsourcing are aware of those limitations and it's fine with them, okay, but we've got to do our homework before we start. So we have to consider what's really important here: time, cost, accuracy, others as well. There are different options available. There could perhaps be other alternative data sources that could be considered. And if there are not, before going into crowdsourcing, there should be a serious discussion about the use of probability surveys. It used to be that probability surveys would take a long time to design, implement, collect data, analyze, but now we've done a really good job in the last couple of years in StatsCan to have a much shorter time frame. We've got rapid stats surveys that are going on, that from start to finish, it's about 3 months. The Canadian Perspective Survey Series is an example of something that can be done very quickly. Results were out less than 2 weeks after the collection ended. So these probability surveys, what is appealing, even though they have a smaller sample size, is the fact that there's a much better control over the potential bias compared to crowdsourcing. So we will continue our research projects. We will try to develop some quality indicators. This is something that our advisory committee on statistical methods emphasized. They said we should try to come up with some way to quantify the quality of the crowdsourced data. We will find ways to implement some kind of protection against the vulnerabilities that I've mentioned previously. And this guideline on crowdsourcing will be finalized very shortly. So that ends my presentation. I am open to questions. Feel free, and you've got my coordinates there if you don't have a question today. And if the question is later, tomorrow, next week, I'll be happy to help. So thank you very much, everybody.
Thank you very much, Renaud. Thank you very much for your presentation. Now we'll start our period of questions. And just to let you know that we ask people to raise their hand, and Catherine will be keeping track of who asked the questions, and then we will open up your mic so that you can ask your question. I'll keep an eye on the chat as well. So is there a question to begin with? I have lots of questions. So if there is, why don't I start off with a question, and then people can, because I see we have quite a few participants. One question is, who decides on the topics or the questions to to be asked? Did it come from different sections within Statistics Canada?
Yes, from different sections in StatsCan, sometimes even from the outside. For the one on healthcare workers, for example, was from the, forget if it's Health Canada or the Public Health Agency, but they wanted to get data on the healthcare workers. So who decides? There were some topics that were brought forward by people inside StatsCan, and we ended up rejecting those those ideas because we felt crowdsourcing would not be an appropriate tool to collect data on these particular topics. So yeah, it comes pretty much from everywhere.
Okay, so the criteria is when it's an urgent question and you don't have the time to develop a more sophisticated survey, or
it would certainly be one of the criteria. If you need data in a month from now, I don't think I can implement a proper methodologically sound survey to implement everything, get the questionnaire tested, and go through all different steps, could reach out to the respondents and do some non-response follow-up and so on and so forth. So maybe crowdsourcing is the way to go. But again, being very aware of what the limitations will be of the data you collect. Because yeah, we can have something probably set up fairly quickly and we can leave it open for a week or two and then quickly send you the data. But will that data suit your purpose? Will that meet your objective, meet your needs? Something else to consider.
Okay. Is there
yes, we have a question, first question from Geneviève Brunet-Gauthier. You can ask your question.
Hi, thank you for your presentation. That was quite interesting. I was wondering, for researchers who do ask to have access to these data sets, are they provided with the guidelines that you just presented, like, for example, the different wordings that they should use and how they should use the results from?
Yes, the data sets are available in our research data centers. And we've provided documentation on the limitations, for example, not producing any totals. And we do give some explanation on how the benchmarking factors were used. So yes, we use the terminology and we say what the limitations are. Again, that these data should not be used to draw inference on the Canadian population. It's just representative of those units that did participate. So we have proper documentation accompanying the data files, yes.
And would that documentation also be available for prospective researchers? Is it available on the website, for example?
You mean the Canadian Perspective Survey Series, you mean, or?
Yeah.
Yes, if you go on our StatCan website, there is survey programs and something, I forget exactly what it is, and don't use our search engine because it's terrible. But if you go under survey programs and yeah, I think that's what it is. It's on the welcoming page as soon as you select French or English, and then you can have a list of all the survey programs we have, and you can access the proper documentation. So you just go by alphabetical order, and you'll find the Canadian Perspective Survey Series if you go in English. And if you want the crowdsource, search under I, which is the impact of COVID-19 on Canadian population, and you will find all the documentation we have.
Okay, thank you very much.
You're very welcome.
Is there another question? So the results, I'll just ask another question while we're waiting for, so the survey result, the surveys themselves will be available in the RDCs for research, is what you just.
There is a public use microdata file
available,
and we also have the more complete, if I can say, crowdsourcing data files available in the research data centers.
Okay. Catherine, just jump in if there's another question, because I can, I have many questions.
We don't have another question.
At the moment, okay.
At the moment, yeah.
Since you're collecting emails, that was really interesting that you have emails to create a pool of, for publicity and to people, I suppose, to also send another survey out. Was there ever a temptation to try to link or to do a follow-up survey when you've from the first one to then use those emails to go back to the same people and say, okay, how are you doing now?
No, I'm not saying it wasn't discussed. If it's been discussed, I'm not aware of this. So as far as I know, we haven't talked about the fact that can we go back to, or should we go back to these people and say, back in early April, you answered our first crowdsourcing and then you participated in the mental health and the perspectives, discrimination or perceptions of safety. How are you doing now? To my knowledge, this is not something that we've considered so far.
Because that would be amazing, I would think, to go back, since the first survey had 100,000 respondents, which I think you said.
No, the first survey had
250.
Close to 250,000.
250,000, which is amazing.
240 something, yeah.
Yeah. And you must have been stunned when you came in after the weekend and saw it.
Yeah, well, we saw 130,000. I thought there's definitely a zero too many, perhaps two. But no. People in charge of collection said, no, that's what we got. This data keeps coming in. So, and we hadn't even officially launched it as well, because the first publicity blitz was on that Monday, where we already had 130,000.
Okay.
Which kind of, in a sense, it almost, how can I say, we were kind of a victim of our own success, because then the expectations were that, oh yeah, crowdsource, we're going to get lots of people participate. We're going to do that. Then there were discussions to get one out every week and have multiple on the field at the same time. It was like, okay, whoa, hang on a second. Because after a couple, we realized, we already saw the second one that we went down to 50,000 or so. And then the next ones as well, where this 50,000 was boosted by friendly reminder email to some previous participants. So had we not done that, we might not have had the 50,000 we've seen. So it was a big success, the first one, but only the first one. And as I say, novelty wears off. But the thing is, one thing also that did happen, lots of people said, oh, that might be a tool that would be useful for me if I can get my hands on, never mind 250,000, if I can get my hands on 50,000, that's a lot. And I would be interested. And then all of a sudden, it seemed like you have a new toy and everybody wants to play with the new toy and everybody wanted to use crowdsourcing. Okay, if you want to use crowdsource, we need to have serious discussions on what can it do? What's your purpose? What do you want to do with the data? Mm-hmm. Yeah, if time is an issue, okay, that's something. But again, if I run something quickly and I give you data, then you just can't do anything with it. Maybe you need a bit more time, or there are many different dimensions that should be considered. So, and that's why we rushed, or we emphasized in the importance of completing those documents that we had started to write before the pandemic, just so people are aware of what can be done with crowdsource and what cannot be done.
Okay.
Because it's a new toy in the toolbox, but doesn't mean you have to use it all the time.
Okay. Is there another question?
Nope. No.
Not at the moment. I was stunned that you said about 3/4 of your respondents are women. Yes. And not for the parenting survey
90%.
Or parenting initiative, 90%,
yep.
Which suggested to me that women were using that one to have their voices heard. There's a clear need for, we see this disproportionate impact on women of COVID and in relation to parenting. And you talked about benchmarking and calibrating the sample, but was there a thought of using the parenting initiative to just look at the women who responded, since clearly there was this surge of response among women, and then, okay, so use the parenting survey to look at what women said at that point?
Honestly, I'm not involved in the analysis, so this is something I could find out asking people who were in charge of the analysis, because like I said, I don't know exactly what was. I would review the text that would be published in our daily, but I would not be part of the team that would conduct the analysis. And I know a lot more is going on behind the scenes. And to come up with that final product, a lot more has been done and discussed before. So unfortunately, I cannot give you a very precise answer at the moment.
Okay. Okay. Are there other questions?
No desire.
So to say, well, thank you very much. If there aren't other questions, Martin has provided his email address, and this will be available for, it'll be registered and available probably by the end of the day on the website. And I thank you very much for your presentation today. I'll just see if there was, I do want to let you know that please follow us on Twitter and on the website for announcements of the next activities. And the next webinars will be happening in April. The dates are going to be announced in connection with the Emerging Excellence Conference, or the Colloque Excellence en Relève. So please, everyone, stay tuned and participate in the seminars that are to come. And thank you very much. Thank you very much for this.